Okay, it looks like we just went live. Hi, everybody. Welcome to our COVID Community Connection series. Today, we're going to be talking about some mental health services. My name is Dee Dee Carmichael. I'm the Director of Workplace Campaigns with United Way of Lebanon County. And I have with me today Martha Thompson from Empower the Mind and Brenda Startoni from Lebanon County Crisis Intervention. So we're really happy to have both of you here today to chat a little bit about mental health, which is something I think that a lot of people are thinking about more than usual in these unusual times. So I just want to note before we get started that anybody watching live on Facebook can feel free to write live comments during the broadcast, and we'll be able to see those. So if there's anything that you're curious about that you want to talk to these two providers about, feel free to chime in the comments section. So I'll just start with giving both of you the opportunity to introduce yourselves, kind of talk about what services you provide in Lebanon County and where you work and what you do. So we'll start with Martha.
All right. Thanks, Dee Dee. Welcome, everyone. Thanks for joining us on this beautiful sunny day. So my name is Martha Thompson, and I'm the founder of Empower the Mind, which is a small outpatient counseling practice in Lebanon and Pottsville. So we provide a lot of services, outpatient counseling, mental health, drug and alcohol, kids, families, the whole mixture of all of those things together. We also provide the student assistance program liaisons and support in the schools for Lebanon County. So that includes, some mental health, behavioral health, at-risk youth. And so we're helping the schools, we're helping the kids, we're helping the families in that capacity as well. And we're still doing that virtually. So all of the schools are able to access the student support services through either us or through the school directly. We're just providing everything virtually or over the phone.
Thank you. What about you, Brenda?
Well, I don't have such an elaborate. I'm Brenda Startoni. I'm the program director for Lebanon County Crisis Intervention. We are part of WellSpan Philhaven. We are a 24-hour hotline. So we man our phones, like I said, 24 hours. We also do, under normal circumstances, we do outreach to the community, and we see people in the ER, and we have our walk-in open. Those services I know we're going to talk about, but they're a little more modified right now. But we are available to support people for basically whatever they need. After hours, we're on call for a lot of therapists and other nonprofit agencies, so we can kind of connect them with resources and information.
Awesome. So I just kind of wanted to get an idea from both of you about how your service model has changed in response to COVID-19, because I know everybody is changing everything at the drop of a dime right now. So Brenda kind of touched on that a little bit in her response, but if you want to elaborate on that, Brenda.
Sure. We do a lot of face-to-face normally. Right now, we're limiting that. So we still have our hotlines available. There's someone answering them 24/7. Our walk-in center is actually still open. Our current hours are 8 a.m. to 8 p.m. We have a setup where we use phones to talk to people through a window to our waiting room. It's not ideal, but we can still see people that walk in that way. We're looking at expanding those hours to from 8 a.m. to 10 p.m. One of the benefits, if you can find a benefit of program closure, is that other Philhaven staff have been resourced to other areas of Philhaven because their programs have closed. And I've been fortunate to get several of those staff so that we have plenty of staff available 24/7 to talk to people in the walk-in or by phone or whatever. We are greatly limiting our mobile crisis. We still will respond if needed, but we're actually hoping to rely on the police when it comes to somebody that needs to come in but isn't able to do that themselves and need some assistance to get to safety. So we are limiting our walk-ins. Now, we're limiting our walk-ins, but we're probably working on increasing our community outreach. There are things that we're trying to put in place now to make sure that people that need it have masks. So will be able to kind of deliver those things as needed. The other thing that's changed is our response to the emergency rooms. We spend a lot of time in the emergency rooms. Again, we're trying to do more over the phone than actual in person, but we still are over in the ER many times a day.
Mm-hmm.
So those are, I guess, the biggest changes, or we're doing less face-to-face and trying to be creative in how we meet the needs of the public and do it safely for our safety and their safety as well.
Right. How about you, Martha?
Sort of similar. We have the option to do face-to-face services still, but that has really been limited to somebody who maybe doesn't have availability to access technology or consistent phone service or whatever the case might be. So fortunately, we were already doing some types of telehealth. Telehealth has kind of become the catch-all term for, services much like this, where we're all connected over video chat, over Facebook Live. And so, whether it was hospitals doing, check-ins with patients or psychiatrists seeing clients for med checks, we were doing some outpatient therapy over telehealth. And so we had that system in place, and we were able to just kind of shift everybody over to utilizing either video chat that's secure and confidential, or the telephone, again, for people that weren't able to utilize video chat. So we can email all the paperwork back and forth. People can even just use their phones to snap a picture of like their insurance card, send it in, and we can take care of everything all electronically. So we kind of keep it moving and roll with it.
That's great that you guys kind of had that infrastructure already in place, and now it's just the time to dive into it when you're seeing this need here. But more on the need, I think everybody is feeling right now in this time of social isolation that increased need for mental health services. Mm-hmm. Are you getting new clients calling in and needing help? People who maybe haven't struggled with mental health issues before, who are really having a hard time with social isolation, and how are your organizations kind of handling both that volume and all the challenges that go along with not being able to have that one-on-one with a person in real life?
Right. One of the things that we've noticed is people are asking more questions when they call. They understand that they're not going to come into the office for a normal therapy appointment. They're like, so what's it like to do this over the computer? Does it feel different? And once you get past that initial hurdle of like, it's just kind of weird to connect over the computer, it kind of feels a lot like normal therapy. We spend a little extra time setting that up for somebody who's brand new, talking about making sure they have, access to a headset or a private location, secure Wi-Fi if they don't have consistent Wi-Fi. A lot of the libraries are offering Wi-Fi. So I've had people sit in their car outside of a Starbucks, and it's nice. It's quiet. They get a break from their kids or their family, and they're able to have their therapy session. It's just they're sitting in the car in the Starbucks parking lot. So we're being as flexible as possible.
Yeah.
That's a good one.
Mm-hmm.
Brenda, do you have anything to add to that?
Yes, I do. We have not seen an overall increase in the request for crisis services, which first was kind of surprising to me. But I do think a lot of people are listening, to the news and staying home. A lot of people are afraid to come to the hospital, which can be a good thing, but it also can be a barrier for someone who actually needs services. The other thing is there's a lot of COVID hotlines out there. WellSpan has one, CDC has them. So a lot of people are going directly to those lines for help. And I even believe 211 has been seen their volume increase as well. So one of the things that I'd like to do is make sure that people are aware that they can call into our office. We have staff ready and waiting to talk to people. But we have seen a couple of things so people that are usually in programming during the day, if you look at someone who maybe is diagnosed with a developmental disability or autism or somewhere on the spectrum, they're now having to be isolated at home, and they have limited ability to understand everything that's going on. So we're seeing escalation in behaviors like, why can't I go outside? Why can't I do things like that? and that they're not used to. So their behaviors may escalate in more of an acting out frustration because they can't continue their normal routine. We're also seeing people that use their normal coping mechanisms. They're being stretched to their limits, and they're finding that the things that they use to cope on a daily basis aren't adequate anymore. And that can be an issue. The other thing is that people that live with a chronic mental illness, the way they receive services is changing. And sometimes that's hard to adjust to. Like Martha was talking about the Zoom meetings and the telepsych and the telephone therapy sessions. All of that is very new. And I am very IT, what's the word? I'm not good at it.
Yeah.
So, if you have an old computer, or, if you're not up to date on how to get into Zoom and all of that, it can be very overwhelming. And then on top of that, you're dealing with some sort of chronic mental illness. So we've seen an increase in that population coming to our emergency room because they're coping, they've exhausted their coping skills. And then that's when we may get involved. So those are the significant changes that I think that we've seen.
Yeah. And is there anything else in your toolkit as a service provider to help address those issues when, you have folks who are not comfortable with using technology? Is it just the emergency room, or is there, any way to get through to them otherwise?
Well, yeah, we don't have to go through them. Actually, that is a great segue. One of the things that we've been doing specifically, or we're starting to do more of, specifically with kids or anybody that has special needs, like autism or developmental disabilities. Unfortunately, the resources on a good day is very limited to meet the needs of those individuals. So if we bring someone like that into the emergency room, the likelihood of them being placed is very low. Mm-hmm. So what we're trying to do is to establish team meetings with their providers through Zoom or another medium to kind of see what we can put in place to maintain them in the home rather than bringing them into an emergency room. So that is one way that we're trying to divert people from inpatient treatment.
Yeah. Anything else to add to that, Martha?
I think we've seen a lot of, again, it's technology based, but I think we've seen a lot of forums like this that weren't there a month ago. People would maybe do a, Facebook Live here, or they would post a little 30-bit, second blip here or there. But there's, Alcoholics Anonymous has created, round the clock, round the world virtual meetings. Narcotics Anonymous. I know, you guys just shared my post there. We're offering some free support groups twice a week. One of my colleagues is getting ready to put together a drug and alcohol recovery specific virtual support group. So I think as we're starting to see more and more things pop up, we are seeing a lot of just like free support. People are sharing things, on Facebook, on Twitter, on Instagram, to just, again, provide support. Doesn't necessarily have to be a professional format to where maybe they don't necessarily need, therapy, or they don't need crisis, but they just need somebody to validate their experience and let them know that they're not alone. And, people are struggling, and it's okay to struggle. And if you need something, there are resources. So I think that's been a really neat thing to watch as this has sort of unfolded. We're kind of coming together.
I agree, Martha. And, I think it is really great how we're seeing people build community online in a way that we haven't seen before, because you can't do it in real life right now.
Right.
So yeah, that's a great point. I'm happy that you brought up those support groups. But just as far as looking forward in the situation, what do you both anticipate as the situation evolves? What can we expect next?
You
want to take that one, Brenda?
Got a crystal ball. Brenda, thoughts?
I honestly feel like right now the people that have depression or anxiety, they're kind of maintaining. But the longer the isolation and the quarantine goes on, the harder that's going to become. And I think in Lebanon County, we're not seeing numbers, thank goodness, like, other parts of the country. When those numbers increase, I think the anxiety level will increase as well. One thing that we haven't talked about, which I think is a very important thing, I'm sorry if I'm intruding on you, Martha, but our first responders, our medical personnel, even our behavioral health personnel are all feeling a lot of anxiety and in need of more support than usual because, they're facing things that the world hasn't faced before. They have homes, they have families, but they're here and they're providing services so that we can survive, that we can live, that we can prevent the spread of this. So I'm seeing that our needs right now are less with the general population and more with our providers, just keeping them going and motivating them and allowing them to know how important what they do is to us, to everyone. So, WellSpan has done a fantastic job of developing like a peer-to-peer support line. They're doing group chats. Our CEOs or our leaders are having Zoom meetings, and today we're getting pizza. But things like that mean a lot to the staff. That people realize that they're here. We're here. We're on the front lines because we're still in the ERs. We're having to wear masks. I'm not wearing one right now, but when we go outside of our office, we have to wear a mask. If we go into the community, if we have to go into the community, we're in full gown. That's not something that Crisis ever did before. And it's scary. Not only that, I'll stop in a minute, Martha. Due to some programs closing, staff, like I said, have been repurposed in other positions. So they're taken from their full-time job and the next day they're reporting to a brand new location and have to learn a brand new set of skills. And that's challenging as well. And they may not be able to work the same hours. They don't have the same peers that they're working with. They're being supervised and trained by different people. So that world, the world of the essential personnel, is really causing a lot of stress right now. Yeah. And, I feel like that's where our support is going, or needs to be for the moment.
Yeah, that's a great point. It's not just the people who are isolated socially, but it's also the people on the front lines who are dealing with this every day. Yeah. Anything to add, Martha?
No, I think that's a great issue that is, on some levels getting underplayed, or, we're paying a lot of attention to other things, because our essential personnel are people that might not be able to access some of the supports because they are still out on the front lines, providing services. Even our restaurant workers, like the people that are at work every day, are definitely, facing with that. So I think, as a provider, being creative with the times and our flexibility and when we can provide services, Crisis is 24 hours a day. We're trying to offer things, afternoon, evening, we've got availability on the weekends. And I think it is that way to find the niche to connect with people, to continue to provide them with support in any way that we can, even just giving them shout out on social media, or, sending people a text message and just saying, hey, how you doing? Whether that's your staff, your colleagues, your friends, your families. It's about connection. And however we can do that while we maintain physical distance.
I've started thanking people. And I know they look at me because a lot of times I have a mask. So they are, who is this weird woman in this mask? And my mask has pigs on it because my mom made it for me. But,
I drew a cat face on mine. So
good. So, at the grocery store, just saying, thank you for coming to work today. Just in general, I think that means a lot because, like you said, people at Turkey Hill, at Giant, they're being exposed to so many different people. And we need, if I go to Turkey Hill frequently now, you know what I mean? So we need those services. So yeah, connection is the key, like Martha said.
Yeah. Both of you are service providers. What do you think that people are experiencing right now as far as their emotions, their response to this pandemic? How are people expressing that to you as far as how they're dealing with things?
Can I jump in, Brenda?
Yeah, go ahead, Brenda.
Okay. So, I think Brenda touched on it a minute ago. People with, depression, anxiety, current things, they're managing as best they can. I think week 1, week 2, a lot of people were sort of like, this is going to blow over. Let's see what happens. Mini vacation, kids didn't have to do schoolwork.
Yeah.
Week 3 was last week, and the schools and everybody were like, oh goodness, like this is real. And so last week was kind of like a busy week in adjusting to getting the students hooked up with technology, getting their iPads, their laptops, their tablets. So everybody was busy. So that created a bit of a distraction. Mm-hmm. Now we're kind of getting into the groove. And so I suspect, similar to what Brenda said, we're going to start to see people going, now what? Because now I don't have all of those other kind of initial shock, denial. There's a lot of grief with this. And so I think it's now and into the next coming weeks that we're really going to see the sadness, the, people struggling with isolation, the anxiety, the fear. When is this going to end? My life is never going to be what I knew it. And so really figuring out how do we support people with grief.
Exactly. And, a lot of the people that live with a mental illness, a part of isolation is part of their normal everyday life. And it's the providers that are involved in providing them service. That's their connection to the world. And now those providers aren't able to see them. They can call them, but they can't see them. So I think that we're going to see an increase, just in people struggling with being alone. And Martha, you said something else. What did you say? Forget it. I'll think of it. It'll come to me.
There's so much smart stuff. It's hard to keep track.
See, I'm just so smart and thinking so much that it comes out my ears instead of my mouth, and it's all.
Yeah, I know something that I'm feeling is this kind of need to have perseverance during this time, because it's starting to feel really like this is the long haul. How do we buckle down and really readjust to this was a temporary crisis, and now let's bunker down, and what's life look like now?
Right. We went from a sprint to a marathon.
Yes. And see, it came back to me. You said about the first couple of weeks, like a mini vacation. So now parents and kids are like, okay, I'm done with this now. You know what I mean? Like I played all the games. We've baked, we've done all these things, now what? And so I think parents are going to have to become a little more creative, and that is easier for some than others.
Mm-hmm. Yeah. Right. And you even think about a lot of people that, the first 2 weeks, their companies, their bosses, they were like, we're going to get 2 weeks off with pay and benefits. And now it's starting that impact of you're furloughed, you're unemployed. Can you apply for unemployment? So the realities of this, like you just said, Dee Dee, like preparing for the long haul, like that's really where we're at. And I think that's going to amplify a lot of things that people are struggling with.
And what can people do to take care of themselves during this kind of long haul trek towards whatever the future holds?
Right. I'm going to start with pacing yourself, because I think a lot of people came up with all these projects, or they get all the homework from the schools and they're like, you do it all now. Slow down, do a little bit every day, create a bit of a schedule, have some boundaries, self-compassion.
Allow yourself to feel scared, to grieve. I think one of the most important things, and I'm all about be kind to your neighbors, stay connected. People are out walking their dogs, wave to the people on the porch, that kind of thing. Take the opportunity to talk to someone while social distancing that you've not talked to before. It is so important to stay connected. If you have an elderly neighbor, or someone that struggles with a physical or mental or behavioral health need, reach out to them, see if they want or need anything. Those are really, really important things. And the littlest things, just saying hi, how are you dealing with all this, can mean the world to people.
I love your response, Brenda, because my question was, how do you take care of yourself? And you responded by taking care of others. And I think that is really great. No, I think it really is a way to take care of yourself as well, because there is that sense of community there, and how we all work together towards something that's going to work for everyone.
Definitely. But point of caution, don't do that to an extent that you then forget to take care of yourself too.
Yes.
And I know that is something, especially for those of us that have been tapped as essential, that are in some type of direct service or helping profession. We get so much of our own feel goods from connecting and helping with other people, that we have to remember to take care of ourselves too.
Yeah. And I know self-care right now is it's a buzzword really, but it's so important to know how to take care of yourself. So what are your kind of strategies personally for your self-care, if you don't mind sharing?
Yeah. So one of the things that I do, my significant other and I both try to take breaks, and sort of tag in and tag out, as far as like sort of if he needs a break from, parenting for a little while, like let him go to the basement and watch a rerun on ESPN, or, have me take the kid and go do something, or, I'm sitting in my office today so that I can, have some privacy. So I still get a chance to get away. So I think creating some boundaries and really checking in with the people that you're around on if you need some like time away. I was talking to another colleague the other day, and, her and her significant other are both working from home with the kids, and everybody's schooling and still doing their professional life. They want a day away and a break, but you can't take a day away because like we're all in the house together. So figuring out what does that look like, even if it's just, maybe some extra time and take a bubble bath. But creating boundaries is super important. So increase communication and put some boundaries in place.
I agree.
Brenda.
Read a book. I have not been able to make time to do that yet, but it's on my list. But for me individually, I have 4 dogs and many children, adult children, but spending time with them, and we like to hike and get outside, and we're able to do that. The weather has been allowing us to, we have a piece of property that we can go and, hike and do things out there. And, when you're out there, I every weekend that we go out there, I think to myself, the world doesn't seem like chaos here. I'm at peace here. And I think that that's important. Find your happy place. Even if you're sitting on the porch, if you're not able to, but just get outside, get some sun, get some vitamin D. And that will make things a little more, a little better. If you just are able to take a few moments and breathe and, spend some time taking care of yourself, however that may be.
I think with reading, we can't go to the library right now, but most of the libraries, especially the Lebanon County libraries, all have Wi-Fi that we can access. There's books you can download. And I recently saw that Amazon is giving all of their downloads for free. So people can download and read as much as they want. So that's kids' books, adults' books, fiction, history, novels, whatever. So again, it's definitely something that's a free resource out there for people to be able to access.
One thing we didn't talk about that I think is very important, people need to turn off the news.
Yes.
One thing we learned from 9/11 is people can experience vicarious trauma or secondary trauma by watching the news and these things over and over, and we need to take a break from that. My husband keeps it on in the background. He's working from home as well. And I'm like, turn it off. We don't need that stuff filling our head constantly. If you check in with the news once a day, you're going to be pretty much up to date. So I think I encourage everyone to turn it off. That just increases our anxiety and feelings of, being trapped or overwhelmed. So,
Yeah. Thanks, Brenda. I think that's a great point that, all of us are sometimes guilty of kind of tuning in a little bit too much.
Right.
But, what can the community at large do to help others stay mentally well?
I think kind of along those lines of, focusing on other things that are going on. What are the positive things? Like, again, we've started talking in this conversation today about people creating connections. And so our community is pulling together. So highlighting those things on social media, highlighting those things when you're talking with other people, so that kind of creating that boundary that says, I'm going to talk about like the good stuff that's happening here, looking at the positives and getting outside, getting the sunshine, moving. What book did you read? What movie did you watch? Finding other things to shift the focus on. I think Lebanon is starting to do some cool things with, like the virtual dining group that is on social media.
Yeah, that's fun.
And the restaurants are allowing people to, purchase additional meals. And those meals then are prepaid for a family that maybe isn't able to order pizza, but they could go there and they could get pizza. So I think that's been a really unique thing that our community has done. that's been pretty cool.
Mhm.
Again, staying connected. One thing you talked, Martha, about projects, but projects can be good. This is the time maybe to clean out a closet that you haven't seen for years, or something like that. There's a lot of places online to learn or to do yoga or meditation, things like that. WellSpan offers access to a site called My Strength, and they have like videos and different ways that you can cope and meditate and informational stuff that you can do online, and it's individualized. I can give you the link to post then for that, but that's available. The other thing when we're talking about the community and like what you can do to engage yourself, there is an increasing need for the masks, the homemade masks. I called my mother this morning and I said, organize your quilt guild. We need to, WellSpan has a pattern on their
website.
Thank you. WellSpan has a pattern on their website, and they, and I personally, I see people on the street. You need a mask. You should be wearing a mask. That kind of thing.
Yeah.
And we need that. That's one thing that we need. There's also like WellSpan and Phil Haven is, they're collecting these things and the information for the drop off and what the way that they have to be made is all on their website. But that is a huge help. And there's a lot of sewers out there. So that would be a huge help for everyone in the community.
That's a great point, Brenda. We've kind of been casually mentioning a couple of resources throughout this broadcast, but I just want to make a point to ask both of you, what are the free resources that are available to our community during this pandemic to help offer support with mental health services or anything in that wheelhouse?
Sure. I mean, like you said, we mentioned a couple, and I love that Flame is posting them kind of in the comments there so people have access to them. I think it's important to remember that the Pennsylvania Department of Public Health has put up a warm line that people can access. And then, we have 988, which is also a national hotline that people can call in. It can be used for like a warm line and a suicide hotline. Correct me if I'm wrong there, Brenda. But it's much easier to remember 988 than it is to remember the whole national suicide hotline number.
I have that. I don't remember, but I have it.
Okay, cool. We'll get that posted. But then for people that maybe aren't able to talk because there's other people around, they're worried about people listening. Maybe it's a teenager who doesn't want their parent to hear. There's the text line, which is 24-hour free text line, 741-741. And so that's a great resource. I know those are national resources, and the Pennsylvania Department of Health one is at least Pennsylvania specific, but those are great resources for us to not forget about.
Yeah. I mean, I would have listed all of those that you mentioned. In addition to that, Lebanon County residents can always call crisis. I'm not advanced enough to be able to type in information and talk at the same time. So I'm sorry. That's going to have to,
We'll get it after.
Yes. But yeah, the suicide hotline, the national line is 1-800-273-8255. That's been around and that's still available. Right. Again, our number, WellSpan offers open access, it's called, where they will do therapy for new intakes. You can call their number and I'll provide that for you as well. For if somebody just needs to talk to a therapist, and then they want ongoing services, or, they just need to talk to them at that moment. I mentioned My Strength. WellSpan has their COVID-19 resource center on their website and has a lot of resources for the community as well. And the CDC, all of those, there's a lot of good information out there. I mean, I would not necessarily trust everything you see on Facebook, but if you go to those websites that are reputable, there's valuable information out there. And there's NAMI has groups, Naranon. There's a smoking I can't say that word, cessation.
Right.
Stop smoking. All of those things. And there's more coming out every day. So there are a lot of opportunities, and I think this whole thing is we're going to see a huge shift and change in how we provide services in the future, and the access to services. So I think that this kind of gave us a jump start.
Yeah,
where we're going, but we're just getting there a lot quicker.
Yeah, absolutely. I know here in Lebanon County, SARC, the Sexual Assault Resource Counseling Center, they still are staffing in the office for walk-in. They are also 24-hour crisis line, and they provide counseling for, all sorts of trauma. They also have their LGBTQ drop-in center hours that they're hosting virtually. And then I know that our Domestic Violence Resource Center here, DVI, is also providing, their hotline is still 24 hours a day. They're posting some trainings and getting some of those kinds of things up on their website. So we've got stuff coming. It's kind of in the pipeline. If it's not already up, it's definitely evolving.
Yeah, I'm glad you brought that up, Martha, because our community connection conversation for Thursday is with SARC and DVI. So if people want to tune in for some more specific details about how our service providers are handling the challenges with, increases in domestic violence and keeping kids safe during these times, definitely tune in on Thursday for more of that.
Yeah, I think one thing that I wanted to kind of bounce back to when we just think about sort of free resource, community connection, it kind of ties in with that. For people that have kids and families, or even just want to, entertain kids and families, there's been a lot of chatter on social media about, let's go on a bear hunt. So put a teddy bear in your window, and families are reading the Let's Go on a Bear Hunt book. And then when they're walking through neighborhoods or driving through neighborhoods, they're counting how many bears. I've seen some people posting, let's put Easter eggs up in our windows, so putting large Easter eggs so people can go on neighborhood wide Easter egg hunts. I think the Cleona Park Facebook page posted that earlier this week. So again, I think there's a lot of ways that we can kind of connect virtually and participate. You don't have to have kids to put an Easter egg in your, house window. But that little kid that's struggling because they don't get to see their friends at school, they're going to wave and they're going to walk by and they're going to smile, and, you helped them, they helped you. It's a pretty cool way to be able to connect, and it's another sort of free resource.
Yeah, I was coming back from my daily outdoor time yesterday, and I saw two little girls out in the front, like doing the trucker honk thing. And I honked at them, and I was like, oh, this feels so good.
That's awesome. Very cool.
Did you have something, Brenda?
I was just going to say, I've been really impressed at the amount of people that want to help, the amount of people that have been very creative in how they're reaching, out to the community and to the people that they work with individually. The school districts that create a parade of teachers, having a drive-by baby shower. I mean, people have been really, really creative, and and probably making the community connections much stronger than they ever were, because now that's what we're focused on. We want to engage people, and we're limited in the way we do it. But yeah, I've been very impressed with the community at large, at how they're coming together and going through this.
Yeah, and you'll see at the bottom of the screen now, the ticker tape going right now is our text to give line to support community connections in Lebanon County, to Community Support Fund, which is raising up all our nonprofits who are seeing increased demand during this difficult time, and making sure that everybody has the resources they need to respond to this crisis. So if you're looking to give back financially, if you're able, you can text Help for Lebanon to 41444, and that's at the bottom there. Go ahead, Brenda. Did you have something?
I did have one other thing that I forgot to mention. There's always one other thing. We came up with a challenge that we weren't expecting initially, but we've been trying to support the local homeless population, especially those that have to self-quarantine because they've either been tested and they're waiting their test results, or they've tested positive and need, to self-isolate. If you're homeless and you sleep in a tent, that's really difficult to do. So another example of how the community is coming together, I'm on a lot of task force, but that's one of them where we're working to put a system in place with PEMA and the local providers that serve the homeless to make sure that those folks are cared for. So again, that was just another example of, working with the community to be creative in providing services that are very necessary.
Yeah, absolutely. So do either of you have anything else that you'd like to share before we kind of start to wrap up that we didn't discuss that you think is important for people to know about mental health right now?
I think the two things that kind of came to mind as I was thinking, like, what else do I want to make sure to throw out there and kind of share? We talked about kids and, homeless. I think keeping in mind all of the schools have systems in place for the families that have kids enrolled there to be able to pick up breakfast and lunch. They might be different pickup dates, times, different schools, but any kid that is enrolled in that district, Pennsylvania allows any child now. It doesn't have to be a child that was already qualifying for free or reduced lunches. Any kid can go and pick up those food supplies. And we know that food shortage is a reality right now as families are struggling with lots of different things. I think one of the things from a business owner in our community that I have really appreciated is the amount of resources that the Chamber of Commerce is putting out. They have done a wonderful job keeping business owners up to date, doing virtual phone calls and connections, Zoom meetings that anybody can be a part of. It doesn't have to be somebody that's a chamber member. And I think that's a great way to get resources and information out there. So connecting with, Small Business Association, SCORE, Chamber of Commerce. And we're also fortunate to have a Penn State Extension office here in our community. And they have a lot of resources as well, especially for the farming community.
Yeah.
So there's a ton of free resources, whether it's mental health or business. And I know, if you're a business person and you've lost your job or you've lost your income, it's going to create some mental health struggles. So finding those resources that kind of connect all those dots definitely helps ease some of that anxiety.
Brenda?
I always have one more thing, like I said. Actually, I have two. So one thing I didn't mention is a lot of services are available in other languages as well. So at Crisis, we have 2 bilingual staff. So we're covered from 8 a.m. till midnight, which I'm very happy to say that. So we do have availability if someone calls in. That's Spanish, that can speak Spanish. But for other languages, we do have access to our language line. I just got an email today that that they're gonna increase the availability of that. So that's really important. Welsh Mountain is still open, for services, and they serve the Latino community. So I wanted to highlight that as well, that there are services that are specifically designated for the Hispanic population, and those things are available. And then the other thing, we talked about this being a marathon, and I think that that's important. And we also talked about grief. And if you know about grief, you know that in the beginning, when you lose someone, there's a lot of support. Whenever there's a crisis, a disaster, or a loss, there's a lot of support. And then that support kind of diminishes. But we have to be prepared to support people for the long haul. Because there's people that don't have incomes that, when things change and we switch modes, they're going to have to find childcare. They're going to have to catch up on their rent, put gas in their car. They're going to have all of these expenses that they've been spared from right now, and they're all going to come at the same time. So this is not something, taking care of ourselves and our neighbors and their mental health is not something that is going to be temporary. This needs to be a lifestyle change, and we need to, be in it for the long haul.
Yeah. Thank you, Brenda. I think that's a great point.
All right. I second that. Good job.
Yeah. Were you going to say something, Martha? I didn't mean to cut you off.
No. I was just, I think that is very, very true. It's that, there's all kinds of support right now, and everybody's kind of, dare I say, jumping on the bandwagon. We have to, but it's figuring out what happens in a month, what happens in 6 weeks. Because if we look at, some of the quarantines around the world, it wasn't just a month. It wasn't just 2 weeks. It was 2 and 3 months. And they're just now starting to come out of, some of those quarantines and isolation and lockdown. I think there's also going to be a fear of like, is it really actually safe to start reconnecting? So as much as we're craving that and we're starving connection, physically connecting again, there's still going to be that fear. So that natural sort of push-pull and ambivalence of like, do I or don't I is going to be there. And so it'll be interesting to see kind of how that plays out. So maybe that'll be a good follow-up, a month or two down the road to what we even did today.
Yeah. Well, I just want to say thank you so much to both of you for being here today and for being mental health providers in Lebanon County. Your work is so important right now, and I hope that you're taking the time to feel gratitude and thank yourselves for all the work that you're doing and do all that self-care that we're talking about earlier in our conversation. I really appreciate you both being here with us today.
Thank you for having us.
Thank you.
Yeah. And before we sign off, I have one last plug. Our t-shirt sales for United Way, part of our COVID-19 fundraiser, are wrapping up at the end of this week. So we're going to post the link at the bottom. If anybody wants a, solidarity t-shirt with a nice quote on it, we're still selling those, and 100% of those proceeds are going to go back into our community support fund. All right.
Cool.
Great. Well, thank you both. That's all for today. So we're going to wrap it up. But if you can just click the Leave Studio at the bottom, we'll just end the conference. Okay.
All right.
Thank you.
Thank you.
Bye-bye.
Bye.